Welcome to our explainer on gout. Today we're diving into a condition that's been historically called the disease of kings, but can affect anyone. It often shows up out of the blue in the middle of the night, turning a single joint into an absolute nightmare of pain. We're talking, of course, about gout. So let's get right into it. What it is, why it happens, and what we can do about it.
So imagine this. You wake up and a joint, very often your big toe, is so swollen, so red, and so unbelievably tender that it feels like it's literally on fire. I mean, even the weight of a bedsheet on it would be excruciating. This is the classic, brutal experience of a gout attack. But what in the world is causing this intense, localized firestorm? That's the question we're here to answer.
Right, so to understand that fire, we've got to find the spark. In this first section, let's get to the bottom of the fundamental issue that actually lights the fuse for a gout attack.
Okay, first things first. Gout is not just a joint problem. It's a whole body, metabolic thing. It all comes down to a substance called uric acid. Think of it as a natural waste product that comes from breaking down compounds called purines, which are in our food and are also just part of our cells. When you get too much uric acid in your blood, it can form these tiny, super sharp, needle-like crystals that decide to settle in your joints. And that right there is where all the trouble begins.
So why do these uric acid levels get so high in the first place? This state is called hyperuricemia, and it really just boils down to two main problems. It's an imbalance. Either the body's factory is just churning out way too much uric acid, or, and this is the much more common scenario, the body's filter, your kidneys, just can't get rid of it fast enough. Things like alcohol or certain medications can really slow down that removal process.
Once those needle-like crystals are sitting in the joint, what happens next is this fascinating and pretty brutal chain reaction. Your immune system basically freaks out. It sees these crystals as foreign invaders and sounds the alarm, triggering a massive inflammatory response. Specialized white blood cells rush in to attack the crystals, but in the chaos, they end up releasing all these destructive enzymes that cause a ton of collateral damage to the surrounding tissue. That's what gives you that intense pain, the redness, and the swelling.
Okay. So now we know how it happens. Let's look at how this actually plays out for a person over time. Because this isn't a one-and-done thing. For many, it's a journey that happens in some very distinct stages.
You see, gout doesn't just show up unannounced. It creeps in. It starts silently in stage 1, where you have high uric acid levels, but you feel totally fine, no symptoms at all. Then, bam, stage 2 hits, that first agonizingly painful attack. After it fades, you enter the intercritical period, which is this symptom-free phase that can trick you into thinking you're cured. But if it goes unmanaged, it can progress to stage 4, chronic gout, where these crystal deposits called tophi actually start forming in and around your joints, causing permanent damage.
In that first strike, it's often incredibly specific. In a staggering 70% of cases, it hits the base of the big toe. There's even a name for it, podagra. So why the big toe? Well, it turns out these urate crystals form more easily in cooler temperatures, and our hands and feet are always a little bit cooler than the core of our body.
So you've got this toe that feels like it's on fire. How do doctors know for sure it's gout and not something else? Well, that's where the detective work begins.
Yeah, one of the first clues is checking the uric acid level in the blood. For men, a common benchmark that raises a red flag is a level above 7 milligrams per deciliter. This is a huge clue. But, and this is a really big but, that number doesn't tell the whole story.
And this is where things get really tricky. So listen to this. You absolutely cannot rule out gout just because the blood test comes back normal during an attack. In fact, in up to half of all acute attacks, the uric acid level can look perfectly fine. Why? Well, that intense inflammation can actually cause the levels in your blood to dip temporarily. It's a classic diagnostic trap, and it catches people all the time.
This means doctors need more tools. The real, no doubt about it, gold standard way to diagnose gout is to actually take a little bit of fluid from that inflamed joint. They put it under a special microscope, and if they see those signature needle-shaped crystals, boom, case closed. That's a definitive diagnosis. For more chronic cases, X-rays might show these unique, punched-out erosions in the bone. And of course, seeing those tophi deposits is another dead giveaway.
Okay, so once we know it's gout, it's time to fight back. And here's the good news. This is an incredibly manageable condition. There are really clear ways to stop an attack right in its tracks and, more importantly, prevent them from coming back.
So to put out that immediate fire, you've got a few options. The go-to is usually a strong NSAID, a non-steroidal anti-inflammatory drug, which can bring major relief within about a day. Colchicine is another effective drug, but it's often a second choice now because it can really mess with your stomach. And finally, corticosteroids, either injected right into the joint or taken as a pill, are another really powerful way to just crush that inflammation.
Look, stopping an attack is great, but the real win is making sure it never happens again, right? That's where we get into long-term prevention, also known as prophylaxis.
And before you even think about daily medication, it all starts with lifestyle. This means steering clear of the big triggers, things that are high in those purines we talked about earlier. We're talking about alcohol, especially beer, and cutting back on certain meats and seafood. Getting to a healthy weight is also huge, as is avoiding certain drugs that are known to raise uric acid levels.
And the goal here is super clear. It's a number we can actually track. We want to get that serum uric acid level down below 6 milligrams per deciliter and keep it there. At that level, your blood isn't super saturated with the stuff anymore. This not only stops new crystals from forming, but it can actually allow the ones that are already there to slowly dissolve over time.
Now, if lifestyle changes alone don't get you to that magic number, that's when medication comes in. And the strategies, well, they go right back to those two core problems we talked about at the beginning. You can either block the factory from making so much uric acid, or you can help the filter, the kidneys, get more of it out of your system. For really severe cases, there are even drugs that can convert uric acid into a whole different substance that dissolves much more easily.
So we've walked through the whole story of gout, and it's clear that while it's incredibly painful, it's also very manageable. But here's the thing, gout almost never shows up alone. It has really strong ties to high blood pressure, kidney disease, and heart disease. So maybe the biggest question is this: what if a gout attack isn't just a joint problem? What if it's actually a huge, flashing red warning sign from your body, telling you it's time to take a serious look at your overall metabolic health?